My name is Jing Jing. I'm the founder of psychoharmony.com, a website that helps women deal with PMS-related issues. I'm here at Tao Wellness in Santa Monica, California, and with Jason Moskovitz. He's a licensed acupuncturist at Tao Wellness. So Jason did an amazing job with my boyfriend's difficult condition, where he went to see the Western doctors and they said it's not treatable. But Jason just did a magical turnaround for him, and I'm curious to see what Jason can do for women who have PMS, because PMS is also a very difficult condition for a lot of women to find a solution that really works for them. You know, acupuncture has been around in China for thousands of years, but a lot of people here think about acupuncture as just putting needles all around you. So it's a kind of strange, scary sight.
Yes.
So what is really acupuncture?
Well, acupuncture is the most popular form of Chinese medicine. Chinese medicine being a whole host of therapies that treat the whole person. It's really not just about the body, but we're working with the mind, the lifestyle, nutrition, exercise, ways of managing stress. Acupuncture just happens to be the most popular form of therapy. These single-use, sterile steel needles that don't have anything inside them. We're not injecting anything. It's really about stimulating the body to do what it knows how to do, but just a little bit quicker and a little bit more effectiveness and completion. There's cupping, there's herbal medicine, there's lots of different things that Chinese medical practitioners do. Acupuncture is the most popular.
Right, so it's like a little bit tune-up.
You got it.
From your perspective as an acupuncturist, what do you think are the causes of PMS?
Well, first we have to understand what PMS is, and then see how Chinese medicine views it. So PMS being this collection of symptoms that happens a few days to a few weeks prior to the onset of menstruation. And in Western science we understand this to be a time in the cycle where many hormones are reaching their climax, in preparation for the sloughing off of the menstrual lining, the uterine lining. And what happens is sometimes things like pain. Probably the most popular PMS symptom would be pain. And pain doesn't show up on a blood test. Pain doesn't show up on an X-ray. So in Chinese medicine, we see pain as something that's not physical, but something that isn't moving very well. It's really all about flow. Pain is a sign of an interruption in that flow. And that's just talking about pain. So there's pain, there's emotional upset, sometimes there's dryness, sometimes there's difficulty with bowel movements. There's many different symptoms. So in Chinese medicine, there's a few different ways to look at this time in a woman's cycle. The most common, especially in urban living, is this idea of an interruption in that flow, where we're very stressed, we're very busy, and that can cause an interruption in the flow of hormones, as well as the flow of blood, and that can cause that pain that, again, we know, we feel, but we can't see on an X-ray. So this pain is really about a stagnation of that energy. It can be due simply because there's a lot of stress, lots of anger, irritability, emotions alone can be a cause of this premenstrual pain. So there's this idea of symptoms being very excessive, strong pain, strong emotions. On the flip side, there's certain premenstrual syndromes that come for certain people that show much more weakness. Sometimes there will be very big fatigue, lots of weakness, sometimes weakness in the back, weakness in the legs. In Chinese medicine, we've We look at all of these symptoms and are able to categorize whether this person is going through something very, very strong and excessive that will require a treatment to help relax the mind, relax the body so that things move appropriately. On the other hand, there are these people that have these weakened conditions, and the weakness could come simply because you're menstruating every month. There's a loss of vital fluids every month. That sets up almost any woman for some sort of weakness. And then the associated treatments that come along with that to help strengthen the body and replenish the body of that lost blood every month.
Right. And it's a dynamic process because for women also change from month to month.
Exactly.
This month could be very depressed.
Yes.
Next month very angry.
Yes.
And so how do you help women to be more connected and to balance that? Sounds like it's about balancing, right?
Chinese medicine is really all about balance. And it's always about the whole person. It's not about just that abdominal cramp. We're really looking at what the stress level is like at the work, whether there was a big event that might have taken a lot of their energy, which might have already been low this particular cycle.
Right.
So yes, we're always looking cycle to cycle to see what has changed and if we need to change our approach. Because Chinese medicine is really about customization. Every single woman is different, and every single cycle in that one woman can be different. We might find a foundational treatment, but from week to week, cycle to cycle, the herbal therapy, the acupuncture protocol will change along with it.
Right. So how do you measure that difference? It sometimes can be very subtle.
Yes.
Even a woman herself may not be very connected to what's happening.
Most licensed acupuncturists have a skill in reading the subtleties felt in the pulse reading. We read the pulse in 6 different positions on the wrist and are able to know how the blood is flowing at various parts of the body and the various organ systems. That subtlety alone gives us a lot of information that goes beyond just the verbal communication that takes place. In addition, we read the tongue. It's kind of like our x-ray
I do
of the
that
body.
myself too.
Yeah.
So what does the acupuncture do to treat PMS exactly?
So in our typical case of somebody with abdominal pain, strong irritability, acupuncture is really about, number one, getting the blood to flow correctly. So lots of needles will be placed local to the problem area. There will be plenty of other needles placed at various other points on the body to stimulate things like serotonin to help relax the body, and certain other chemical hormones that are natural pain relievers, natural opiates in the body, stronger than most over-the-counter or prescription drugs that exist right here on our own mind.
I have a buzz after acupuncture.
Yeah. So acupuncture is used many times throughout the course of history for just pain relief, and premenstrual pain relief is no exception.
Does it help with emotional relief also?
Yeah, absolutely. Again, using our example of a very angry, irritable time in a woman's cycle, that relaxation, that might not be coming in the rest of their life that month because they're working a lot, they've got a lot of kids and a lot of things on their plate. Simply taking the time out, number one, helps, but having all of these neural hormones being released to help relax the body, help that blood flow, will help regulate the emotions very much.
Just out of curiosity, for women who have a premenstrual syndrome, how long usually do they need to take the treatment, acupuncture treatment, to see the results?
Well, once a patient comes to our clinic, they'll get an entire intake and a Chinese medical diagnosis after talking to them, looking at them, feeling their pulses, looking at their tongue. So the first treatment's most important. We get to know them and what their lifestyle is like, what their body is like, what their nutrition is like. And then we'll engage in acupuncture, send them home typically with a custom herbal formula. And usually, we have to know what we're dealing with before we gauge improvement. But it usually can take, 1 to 3 cycles to see some improvement.
So that's pretty, manageable.
Yeah.
In 1 to 3 cycles.